Hi everyone, I did my presentation on women's high school soccer. I chose this sport because I work in a physical therapy office and I see tons of young high school students coming in with these injuries. In high school, they're trying to get into college sports, they want scholarships, so they're really determined to get back to their full ability to continue playing. So I figured it was an appropriate topic. Factors that can cause injury in soccer are physical contact, because at this stage they are aggressive and they are trying to play as best that they can. All of the players that I chose are going to be female, which instantly puts them at a higher risk for knee injuries just because the ligaments in their knee are smaller than ligaments in a male knee. The type of field that these players play on can also increase their chance of injury. If they play on turf, they're more likely to stick. The sticking motion helps with the rotation, which causes a lot of these injuries. If they play on a dirt field, it may be uneven. They may trip, which can cause the ankle sprains, or fall into a ditch or hole, which can cause the ankle sprains as well. There are 3 common injuries in this sport. The most common injuries are ACL tears, meniscal tears, and grade 2 ligament ankle sprains. The anterior cruciate ligament is an ACL tear. This ligament is a medial knee ligament. It prevents the tibia from sliding out in front of the femur. ACLs are typically torn when the athlete has an anterior shear and internal rotation subluxation of the lateral tibia on the femur. An individual with an ACL tear will be positive to an anterior drawer sign and have a positive Lockman sign. To assess this, you need to use the drawer test at 90 degrees of flexion. The drawer test at 90 degrees of flexion has the patient on their back, injured leg flexed, and the person performing the test faces the anterior aspect of their knee, both hands below the knee joint. The tester puts his or her fingers on the popliteal space of the affected leg. They then place their index fingers on the hamstring tendon to make sure it's relaxed, and if it slides forward from under the femur, it's positive for an ACL tear. A way to treat this is physical therapy. In physical therapy, they're going to do strengthening, range of motion, and preventative exercises to make sure it doesn't happen again. If therapy is not going to help the problem, then the patient will have to consider an ACL reconstruction surgery using either a cadaver graft, one of their own patellar femoral grafts. All right, exercises that you can do for this. Some preventative exercises are monster walks. The monster walks are going to work the hip muscles. The hip controls the whole rotation of the lower extremity, and if you have better control of that rotation when your foot hits the ground, the less likely you are to have an injury to the knee. The squats are just typical for quad strength, and again, hip strength, which is going to help with the whole lower extremity. Some rehabilitative exercises are going to be quad sets. The quad set is really focusing on tightening the quad and pushing the leg all the way straight. It's really important to get your leg fully straight after an ACL tear, because if you have slight loss of full extension, it could mean a limp for life. Another rehabilitative exercise is 3-way leg raises with a resistance band around your ankles. This will also work the hip muscles. Again, the hip controls the whole lower extremity, and that's the most important thing in preventing injuries. The next one is a meniscus tear. The meniscus tear, there's 2 parts. The medial meniscus is more likely to be torn than the lateral meniscus. This is when the cartilage pad between the tibia and femur develops a tear due to weak cartilage, and it's due to a twisting or squatting motion in the sport. To assess this, you want to look for the Apley compression test. The Apley compression test, the patient's prone on the table, which is face down. The affected leg is flexed at 90 degrees. While stabilizing the thigh, the person performing your test wants to apply pressure downward to the leg and rotate the leg back and forth. If the patient has pain, then the pain presents a meniscal injury. The pain with internal rotation indicates a lateral meniscal tear. To treat these, you can do corticosteroid injections. That's done by a physician. They can help with pain relief and to help decrease inflammation of the joint. With the pain knocked down and the inflammation knocked down, they're more able to get their strength up and get back to their daily lives. You can also use electrical stimulation for muscle strengthening. This electrical stimulation will force those muscles to contract and may help build them back up after recovering. Some exercises you can do to prevent a meniscal tear is eccentric step downs without a riser. This works the hips and the quads because you are doing kind of a miniature squat off of a aerobic bar or a step if you don't have anything else. You also want to do some treadmill jogging. That landing force from running and jogging on the treadmill is going to help stabilize the meniscus and build up that joint. A rehabilitative exercise is side lying clamshells with a resistance band around the knees. With the resistance around your knees, you're opening and closing at the knees, and it's going to work the hip muscles. Again, the hip rotates the whole lower extremity, keeping everything in line when you're running. Another one that is going to be done for rehabilitation is lunges. Walking lunges can be the progression of this, just to work again on hip stability, quad stability. The last exercise that we have is a grade 2 ligament ankle sprain. The grade 2 ligament ankle sprain is when all of the ligaments are stretched to the point where they become loose or can become tears. The ligament sprain often happens when there's a force on the ankle while it's in inversion, plantar flexion, or adduction. To assess this, you want to use the anterior drawer test. The anterior drawer test for an ankle sprain, the patient sits at the edge of the table with their ankle at a 90-degree angle. The person performing the test will grab their lower tibia with one hand and the calcaneus with the other. The tibia should be pushed backwards while the calcaneus is pushed forward. It is positive for a sprain when the foot slides forward. Some treatment for this is some taping. Ankle sprain taping can help stabilize the joint and keep it in a good position while it's healing. The best thing that you can do is also PRICE, which stands for protection, rest, ice, compression, and elevation. All of these 5 components will help the healing process move on faster. Some exercises for a grade 2 ankle sprain preventative are single leg balance on the ground that can be progressed to single leg balance on a Bosu ball. The single leg balancing helps focus on all the stabilizer muscles that are in the ankle and can make sure they fire when you're on an uneven surface, such as running in soccer. The ankle circles are going to just be done in the air, or you can do them on a Bosu ball. Again, the circles help with all those stabilizer muscles, and they make sure that you're strong in any direction the ankle goes. A rehabilitative exercise would be the double leg heel raises. The double leg heel raises involve calf work as well as ankle work. The last one is 4-way ankle with a TheraBand. To do this 4-way ankle, you hold resistance opposite direction that you want the ankle to go, and you'll want to do dorsiflexion, plantar flexion, inversion, and eversion, all to help get that range of motion back. All right, I hope you guys learned something about women's female soccer.